Good morning, America. How are you? I guess it's afternoon here now. I better quit saying good morning. This is Rick Redalen, the Maverick Doctor. I'd like to talk to you a little bit today about healthcare again. Familiar subject, huh? And when I start talking about it now, I get a little angry again. So Laurie and I sold Exit Care, and Exit Care was a huge success. It was doubling in value every year. And as I mentioned, when I faded out of the picture because of health issues, my partners felt they had no way to go. You can't run a company without its visionary leader. So let's fast forward. Now Exit Care sold. It made Laurie and I fairly well-to-do. And here's the problem, though. In the United States, people who have money think they're going to get better health care. Simply not true. But you know what? Our senators and representatives think that, or they'd be trying to change healthcare in America. When they just stop and look at the fact that the next time they lose their loved one, their child, their wife or husband, anybody in their family, they can blame it on themselves that we have the last placed healthcare in the world. So now Laurie and I are still dealing with the AIDS problem. Laurie during this time, developed some problems with headaches and just didn't feel well. We got down to Texas, her health again deteriorated. Not from an immune status. Laurie was most likely not going to die of AIDS, but something was wrong with her. And I started taking her to Baylor Medical Center. I told numerous doctors at Baylor along the way that Laurie was going to die or was in the process of dying. And they said, no, Laurie's doing just fine. Her x-rays and chest x-ray and all of her radiologic work is normal. Now, can you imagine a doctor that thinks just because your radiologic studies and your lab work are normal, that you are? As I told you before, I'm gifted. I know what was happening to Laurie. And I know she was on a downward course, but I didn't know how to do it. And sometimes I got extremely angry over this. And I told her, doctors, if you can't figure this out, let me have her chart for a day and write all the orders for you, and I'll have it figured out in the next 24 to 48 hours. They, of course, would not do that. Being I'm not practicing medicine anymore, suddenly my intellectual level got put down to about the way Northerners look at a redneck in the South. Sorry about that, Southerners. We know that's not true. But I was not allowed to write orders, and suggestions were not taken. Nothing worse than a doctor that can't listen to his patients. One of the things I always told my residents is listen to your patients. They will tell you what's wrong. What happened with Laurie was we continued on with these intermittent headaches. At one point she was diagnosed with benign intracranial hypertension, and they started doing spinal taps to get rid of the headaches. And that seemingly worked for a while, but not really. And then she started having anemia all the time. Now some of these can come from having AIDS, but the people taking care of Laurie, it was just more advantageous for them to just fill up her tank once in a while. It's like if you got a leak in your gas tank and your gas gauge is going down every day, what's the thing you do? Right. Try to fix the leak, don't you? You don't keep putting gas in. That just doesn't work. But that's what they did with Laurie. And one of the times when I brought her in the hospital, she had the most severe headache ever. She had a headache that was just incapacitating, that came on very rapidly. I admitted Laurie, rather they did, on a Friday, and they said, we'll have somebody take a look at her Monday. I said to the ER physician, let me see if I've got this right. You have a patient with an immunodeficiency syndrome that has a very, very severe headache, and at this time she is running a temperature that is significant, and you're going to have somebody look at her Monday. And what is she going to do in the meantime? You're going to give her medications for pain and hope that this is not an emergency? AIDS plus temperature plus severe headache. In my mind, how do you rule out encephalitis? How do you rule out meningitis? What do you think is causing this? And this, to me, is a medical emergency, and you better treat it as such. This suddenly got the wheels of the doctors into motion. Next thing, they had an internist there, an infectious disease specialist, and a neurologist. And they all looked at her, and they couldn't find anything wrong. But they did start ordering tests and try to make sure that she did not have intracranial emergency going on. Nothing was found, and studies continue on to the next week. And again, Laurie was to be discharged from the hospital, but again, her blood levels were low. And this time, I'm not sure who came in to see her. Don't think it was a hematologist, but the doctor that came in to see her said she needed blood. So they just filled her up again. And I said, so every time Laurie comes in with low blood levels, you're just going to fill her up again? They said, well, yeah, that's indicated. And I said, what's causing it? And the doctor, female doctor, says, we don't know what's causing it. And I said, do you think that would be a good idea to find out the cause of this? Now, I feel sorry for you people out there that don't have a medical background. But a medical background doesn't help with doctors in the United States today. They either don't understand or feel their rights have been infringed upon if somebody else is offering ways to do things. So the doctor said, well, Laurie needs a bone marrow done. And I said, well, do a bone marrow then. And she said, well, I can't do a bone marrow. And I said, I did unsupervised bone marrows when I was junior in medical school. You got a specialist to do a bone marrow? And she says, yeah, it does take specialists. And I said, and what kind of specialist would that be? Do you have a bone marrow specialist? And she said, no, but some of the internists can do it, or maybe one of the surgeons, I'm not sure, but we'll find somebody. And I said, so what are you doing now then? Well, we're sending her home after her blood's in. Great. Same problem again. And I tell them, Laurie is dying, you know. And so what happened following this is she said, make an appointment on Monday to get a bone marrow. You know, but Baylor Hospital, when you start calling to make an appointment with somebody that needs something the next day, they say you can see you in 6 weeks to 2 months. Great, huh? They've told you should be seeing and have bone marrow done the next day. They're going to see you in 6 weeks, 2 months. What kind of a medical system is this? Backwards like everything in the United States. Meanwhile, I'm getting angrier and angrier. And then during this time, Laurie starts to get better again, and she's feeling better and says, boy, I'm feeling about the best I've felt in a long time now. We were scheduled to go on a photograph safari to Africa, and Laurie wanted me to go, and I told her I want us to head to one of the Scandinavian countries so we can get decent medical care. Laurie said, no, I'm doing great, Rick. I'm doing great. And I said, Laurie, we know things aren't great. They're great right now. And she said, I won't hear of you not going on this safari. We've been working on it for 2 years. And granted, we had. But we knew that she couldn't go along. Long story short, when I was coming back from Africa, I was in Johannesburg. And I said to one of the other missionaries, I said, something just happened to Laurie. You know when you get that sick, queasy feeling in your chest and you know you've just lost your loved one? Well, that's what I knew. I called up my office immediately. I called up home first and no one answered. Then I called up my office and I asked them to run over to my home immediately. I said, something just happened to Laurie. I got a call back 5 minutes later and they said, Rick, Laurie's just laying there with her hands folded under her chin. Every night she slept and it looked like she was praying. They said, but we can't wake her, Rick, she's passed. And I already knew that. And I was still on the fastest road I could be to getting home. I was flying to Heathrow and from there directly to Dallas. And anyway, that's the story of what got me more passionate about healthcare in the United States. I don't want you people out there, all of our good American people, going through the same things I am. I simply don't want it. A little while ago, I was on the trail with Trump, as I mentioned to you, and I went to Ohio, Pennsylvania, North Carolina, South Carolina, and Florida, and really do think I helped Trump get elected with my great big red traveling billboard. As I mentioned before, you need to support your president. That's biblical. And if you don't know it, look it up in Romans chapter 12. There's a number of other places you can find that in the Bible. But start supporting your president. If you really want health care changes, put pressure on your senators and representatives. These people serving us politically really don't have a clue. And they're not about to cross party lines to make things better for the American people. I think Donald Trump's finding out what Mark Dayton did when he ran for senator a number of years ago in Minnesota. He ran for senator, won it hands down. Why wouldn't he? He was of Dayton department store fame. And he said he's going to change Washington. Well, after 4 years, he said no one can change Washington unless they have an army marching on it. And he said it's like a swamp, and it's so filthy and contaminated, no one there can be changed and get anything done. Mark Dayton, who's a shoo-in to be a senator for the rest of his life, resigned, just like our senators and representatives now should do. They should resign. They should impose term limits on themselves and get new people in there that can work together or will work together. Please start writing to your senators and representatives. Ask them to please do something for you. Do not let them sit on their rear ends doing nothing day after day. Get them to do something for you. I really wish Trump would start working with Bernie Sanders, get a single payer system. I know we hear Liz Wheeler and a bunch of other talk show hosts that say single payer system won't work. Well, it works in every country of the world. It just won't work in the United States because of all of our special interest groups. Wouldn't you rather have each one of these insurance companies raising their premiums 100, 125% per year? And this is going to keep on happening until our middle class has been eradicated. And that's a fact. And a friend of mine was having lunch with a senator some years ago, and that person evidently had a little too much wine to drink, and said the plan in the United States is to get rid of the middle class. I don't know if this is true. I don't know if it just passed on to me because of political interest, but I think you can see they are doing their level best to get rid of the middle class. And they are doing their best to let Medicaid and senior citizens die. Work against it. Get back in the groove. Help your country. Do something. God bless you.